My name is Dilpreet, and today we're going to be doing a video about knees, ankles, and hips. This is week 9. So, before we even get started with anything, okay, so we're going to prepare the rooms before the patients even come over. So, the first thing that we're going to prepare in the room is the coils. Now, before we forget what coils that we need, we're gonna list out these three patients in order. So we're gonna have a patient for the knee, ankle, and then the hip. Now for the knee coil, we're gonna be using an eight channel HD knee coil, and then for the ankle, we're gonna use a foot slash ankle coil. It's also called chimney. And body or head coil if patient doesn't fit with the foot and ankle coil. And so for the hip, we're going to be using a body or pelvis coil, and it's often named abdomen slash pelvis. Now, those aren't the only things that you're going to want in the MRI room. Also, if there's an order for any type of IV or anything, you also want that in the room, and obviously you want new linen, and you want your headphones and your squeeze ball so the patient can alert you if anything is going on. Now, once your room is set up, you're going to have the patient come in, but before he comes in, you're going to do the two main things to confirm that that's the correct patient. So the first thing is going to be the first and last name, and after that, it's going to be the date of birth. Now, once the patient has told you that, you're going to ask the patient, what brought them in today, or, what brings you in today. And you're just gonna cross match if that's exactly what they're here to examine for, and if not, then obviously you would call their physician or anyone that sent them to get some clarification on what's going on. So after that, once the screening form is done and they have nothing MRI unsafe on them, so you're gonna walk them into the room. You're gonna help the patient sit down on the bed, and so you're gonna help assist them. So for the knee coil, let's start. Let's start with the knee patient. So once the patient comes in, they're gonna lay supine, and their feet are gonna go first into the MRI. And so for the landmark that we're gonna use is the inferior patella. So it's like your little knee socket. We're gonna use the inferior portion of that. And so for when we're doing an axial sequence, we're gonna angle it parallel to the joint space. So the coverage is from the superior patella, the top of it, all the way down through the tibiofibular joint, and that's your axial. So then for the sagittal, you're gonna angle or perpendicular to the femoral condyles, and the coverage is skin to skin, so left to right, and this is including the superior patella through the tibiofibular joint. Now for the coronal sequence, we're gonna angle parallel to the femoral condyles again, and the coverage is from anterior slash superior patella through the posterior joint space. Now, so that was the knee. So let's just say now it's the ankle patient. Now we're gonna do the exact same steps. We're gonna explain to them about the headphones and the squeeze ball. We're gonna run the exact same steps for every single patient. Now for the ankle, for the patient positioning, it's gonna be the same thing. So it's gonna be supine, and their feet is gonna go first, but with the foot like kind of dorsal flex. So like the toes kind of go towards your nose, if they can tolerate it, of course. Now for the laser landmark, it's gonna be between the malleoli at that ankle joint. Now, when we're running an axial sequence, the ankle is going to be parallel to the tibio-talar and the mortise joint, and the coverage is from the plantar surface to the foot. Now, the plantar surface, it's gonna go all the way through the distal tibia and the fibula. And now this is including your hind foot, soft tissues, and the Achilles tendon, because most people kind of sometimes they miss them, so you want to be really sure. Now for the sagittal sequence, we're gonna angle. Sorry, you can hear the cop cars. So for the sagittal sequence, we're gonna angle it perpendicular to the malleoli on axial, and perpendicular to the mortise joint on a coronal. So the coverage is skin to skin again, right to left, across the ankle, and this is including the Achilles tendon, because you always want to make sure you get that, never miss it. Now for the coronal sequence, the angles again, it's going to be parallel between the malleoli and the axial, and a perpendicular to the mortise joint on the sagittal. Now the coverage is from the metatarsal bases all the way to the heel soft tissue, and again, this is including your hind foot, and your most sometimes missed is the Achilles tendon, so you want that in there. Now for the hip MRI, again, we're gonna run the same exact thing. You got your coils ready, headphones, squish ball. Now again, same exact position with this patient. So it's gonna be supine. They're gonna have their feet first, and this time the toes are gonna be inverted, aka pigeon toed. So the leg should be flat against the coil, and so the landmark for the laser is going to be a hip joint. So it's centered over area of interest, or whatever the hip MRI that you're trying to the radiologist ordered. Now for the axial sequence, so now this is going to angle between the hip joint, and the coverage is going to be from above the hip joint all the way through the lesser trochanters. And for the sagittal sequence, it's usually unilateral on the affected side. So we're gonna angle perpendicular to the femoral neck, and the coverage is bony anatomy right to left, over the affected hip. Now, lastly, for the coronal sequence, we're gonna angle between the hip joints, and the coverage is including the entire hip joint, anterior to posterior, and that's going to be surrounding the pelvic bony anatomy, and it's going to be the large field of view if bilateral, so a smaller field of view if unilateral, basically for higher resolution. And I believe that is everything that I covered, and again, thank you so much, and that will be the video.